COVID-19 has been clearly understood as an infection of the respiratory system. Even though the primary impact is on the respiratory system, for quite some time now, we have understood how it affects different systems of the body as well. Since last year, we've had some sporadic research studies showing neurological and psychological concerns in COVID positive patients. What we really need to understand about COVID-19 is that it's not been around for long enough, and not enough time has passed for us to really understand the long-term ramifications or even the current concerns that patients can have. One study by Harvard University identified how up to 40% of patients who tested positive had neurological symptoms, mild ones like inability to taste or smell, and more severe ones like being disoriented to where you are or who's around you. In the same study, they also found that up to 30% of people had cognitive impairment. Now, brain functions like memory, attention, or complex planning functions being affected can lead to difficulties in managing everyday life, such as being able to organize your medication, or being able to manage finances, or just being able to function at the level where you were functioning and being productive at work. Now, cognitive impairment can also lead to relationships being affected around you. If your ability to actually hold complex conversations or process information is affected. But now enough time has passed, and we have research that is showing us long-term damage as well, unfortunately. The University of Oxford published a study just last week on April 6th, 2021, studying 2.5 lakh COVID survivors. The study showed that 1/3 of these people, so 1 out of 3 of the 2.5 lakh people, suffered psychiatric mental health concerns or neurological brain damage. What is very surprising and extremely startling is that these symptoms were not immediately present or did not need to be immediately present, but they came up 6 months after these individuals had originally tested positive. Serious concerns like a hemorrhagic stroke or an ischemic stroke, or symptoms of Parkinson's disease, or epileptic seizures or fits, also dementia. These concerns have come up within this 6-month period after the original infection. Depression, anxiety, insomnia, and even substance abuse have come up in the form of psychiatric concerns. Now, the risk for psychiatric and neurological morbidity within 6 months after the original infection is not only for people who've had severe symptoms during that original bout, but there have been instances wherein people who had originally mild symptoms have also reported the same neurological and psychiatric symptoms. Now, my reason in bringing you this video and the awareness is so that you can anticipate and prepare yourself for the possibility of these concerns coming up within your family or for yourself. Be prepared with the knowledge and create a system, create the support system so that early intervention is possible for you and your loved ones. Anticipation of these symptoms is not meant to create anxiety, but just to give you the power to actually prepare and protect. Thank you so much for listening.